In most healthcare facilities, you will be required to record the care that you've given to your patients. Hi, I'm Kathy Getrist, and today we're going to be talking about recording client information. The medical record, more commonly referred to just as the chart, is a written account of the patient's condition and response to the care and treatment that has been provided. The medical record is an important record of care that can be subpoenaed as evidence in a legal case. It therefore must be documented with great accuracy and truthfulness. The patient record is retained after the patient is discharged and even well after a person dies, and is stored for retrieval at a later date as needed. Example comes to mind. My mother was having some health care problems, and she wanted to know if she might access the information from her biological mother, who had died in 1933. So she contacted the medical records department of the hospital where her mother had been a patient, and they were able to retrieve the medical record, and she shared that with her physician, and it gave a lot of insight and was able to be helpful for my mother's medical treatment. So you can see from 1933 to the present, that information is stored for a long period of time. There's several purposes why charting is necessary. The chart should contain an accurate picture of the patient, the care provided, and the response to that care. Also, the information and observations contained in the chart assist the health team members in planning the care that is to be given. Clear and accurate communication in charting is essential to provide clear correspondence between caregivers. It isn't possible for caregivers from different disciplines to all be in the same room at the same time on an ongoing basis talking about an individual patient. But it is recorded by the different disciplines on this chart. And so as a nurse, the nurses can access information that a physician has documented, or a physical therapist, or occupational therapist, or any other number of professionals. As well as those individuals can track the correspondence that the nurses and others have provided. So it provides an ongoing communication system, written or electronic, as opposed to verbal communication. The amount of charting that you will do, as well as the kinds of information that you will be recording, will depend to a great extent on the facility where you work. And those requirements also are different from state to state. Some facilities' records are still being written down in longhand, but the trend in all of them is moving towards computerizing their documentation system. There are many reasons why healthcare facilities are moving towards computerizing all of the records. One is that many caregivers would be able to access the record at the same time. In the past, if I, for example, wanted to make some entry on the patient record, I would have to make sure that the chart was accessible to me. Maybe somebody else would have the chart, and while somebody else had the chart, I would have to wait. Or if I wanted to look up lab values, or you as a caregiver, if you wanted to determine whether or not certain cares had been already given, you would have to wait until you were able to get the chart if it were being used by someone else. With electronic documentation, you would be able to access the information whenever you needed to. Another reason for computerization is that the problem with reading handwriting is avoided, as the record is clearly printed. Physicians and others have kind of a bad reputation when it comes to legibility with their writing. So computerization takes care of that. Patients will be able to maintain their medical record on computer chips that will allow for more rapid care in the event of illness. The possibility of errors and delays in treatment can be reduced. For example, if a patient is able to bring their medical record by a computerized chip to the emergency room, if they're having medical problems, that could be immediately utilized and care could be provided more rapidly. There are many forms that are in the medical record. As I said earlier, facilities differ in the type of forms and the amount of charting on them that is permitted by you, the unlicensed caregiver. The following, however, are the most commonly used forms on which you would be required to chart. The first is the graphic record. The graphic record is used to record measurements of the patient. It may include measurements of vital signs such as the blood pressure, pulse, or respiration, or it might include height and weight determinations. It allows the nurse, physician, and other caregivers to see readings and trends over time because the record can allow for about 4 or 5 days worth of recording of those measurements, so trends can be determined. The flow record is another common record. It's used to document the care that you give. Such things as personal care, appetite, and activity are recorded on a flow record on each shift that a caregiver works. Abbreviations and check marks are used to record this care after it has been completed. The progress note, also called the nurse's note or sometimes called the multidisciplinary progress record, is a type of record that describes in words changes or progress in the patient health status. If you are required to chart on this record, your facility will provide you with additional training in order to do so accurately. Finally, the care plan is a written guide that directs you with the care for each patient. Each patient has a care plan. It's an individualized plan that's written and reviewed regularly for each patient by nurses and other members of the healthcare team. As a caregiver, you will not be required to develop the care plan, but you may identify problems or strategies that the nurse and others may want to add to the care plan. An example might be in the care of an individual, you might determine that because of a painful right shoulder that the patient has, they do not like to be positioned on their right side. So that would be something that you could communicate to the nurse, and the nurse in turn would add that to the care plan so that others might have that information as well. You will be required to follow and review the care plan to help provide quality patient care, even though you will not be utilized in the development of the care plan. Use of medical terminology and abbreviations is common when communicating and charting in health care. The medical profession, like many other professions, really has a language all of its own. The terms will seem strange for you at first and a bit confusing, but as time goes by and as these terms are practiced, they will become part of your language as well. You may not make up your own abbreviations. The medical abbreviations that you see come from the Greek and Latin. I'm sure you, in your email correspondence or letter writing, shorten up words to make it go a little bit more quickly. Those abbreviations are not going to be acceptable in the healthcare facility for your documentation. Imagine what it would be like if each one of us that knows a little abbreviation would utilize those abbreviations. We would be hard-pressed to be able to read or understand what the others had written. Your student manual provides you with a listing of medical abbreviations and terms that you will need to know. At the completion of this lesson, take time to complete the exercise provided. Study the medical abbreviations and terms until you can use them comfortably. Each healthcare facility is required to have a list of approved medical abbreviations. It's part of the policy and procedure of every healthcare facility. You will be made aware of those abbreviations that are approved for use in your facility. It's important that only those abbreviations that are on the approved list in your facility are used by you and others. All patient records are considered confidential because they deal with the individual, private, and personal information about patients and their conditions. The Health Insurance Portability and Accountability Act, more commonly called HIPAA, is a federal law that has established standards for privacy and security of health information. Specific training of all employees is mandated by this act in policies and procedures that protect health information. This training will be part of the orientation that you have to your healthcare facility. I'd like to cover just a few of the guidelines that you will hear during that orientation and deal with the privacy. Chart in only designated areas in your facility, and once you have completed the charting, return the chart to its proper location and out of view of others. Facilities are placing these charts now in locked cupboards where they must be retrieved when they are going to be utilized again. The chart is the private property of the facility, and no portions of it may be removed from the premises. So in other words, it would not be acceptable for you to take a chart home to do your charting after you'd left work. It would never be acceptable for you to take pieces of the chart, different chart forms out of it, and take it with you, make copies of it. No part of it may be removed from the premises, and you would not be allowed to make any copies of any of the chart forms either. If a patient or family member asks to see the chart, you would refer that request to the nurse. It's always acceptable for a patient to see that record, and with patient permission, family members may be able to see sections of the chart as well. But you need to refer that to the nurse or physician because in looking at the chart there will be needing to be interpretation of the information provided, and the nurse or physician are in better position to be able to provide that interpretation for the patient and family. Keep a cover sheet over all records on a clipboard. Things that are on clipboards would be things like I&O sheets. Sometimes flow sheets are on a clipboard, but you can understand that the information on those forms, if they're out in view of others, might be an invasion of a person's privacy. So it is required now that a cover sheet be on top of any of those records on a clipboard. Discuss patient information only on a need-to-know basis. This goes for co-workers that you might have on your unit. If the co-worker is not taking care of the same patients that you are, then you may not discuss the information about the patients that you're caring for with those other co-workers. It's only on a need-to-know basis, and just be discussing patient information with others that are caring for those individuals as you are. There should be never any discussion about patients in public or open areas of the facility because there would be fear of others, patients, other family members, friends, anybody in the public might overhear. Do not leave the computer unattended, and always log off after making your entries. Position the computer so that information is concealed from public view. Sometimes you will find that the computer is stored in a well and a counter is on the top, so that it makes it even more difficult for anybody walking by to see information on that computer monitor. Do not leave charts or computer-generated printout where others can read them or take them with them. Be sure that you destroy or shred any worksheets that are not going to be part of the permanent record. And you would never share your password with anyone else. If someone has access to your password, that person can get into the computer under your name. And if a record is altered, it would be very difficult to prove that it was done by someone other than yourself. Recording the date and time of your observations accurately is a very important part of your documentation. Some facilities use military time, or sometimes called a 24-hour clock, for recording, rather than the 12-hour clock, sometimes called the conventional time. This conventional clock has the AM and PM needed for recording the time. If you are using military time, the hours from midnight to noon are referred to as blank 100 hours. For example, 2 a.m. conventional time is 0200 military time. The PM hours, meaning the hours from 12 noon to midnight on the 12-hour clock or conventional clock, can easily be converted to military time by use of a process called just add 12. If you look at 1 p.m. conventional time, you can see that if you just add 12 to 1 p.m., it would be 1300 military time. Another example would be 8 p.m. conventional time. If you just add 12 to 8, you get 2000, and that would be the military time. The last two digits indicate the minutes of each hour, from 01 to 59. Thus, 05 military time would be 5 minutes after 12 midnight. 0730 military time would be 30 minutes after 7 a.m. 1445 military time would be 2:45 p.m. and so forth. The student manual provides more information about military time if you need a little bit more practice to understand it more clearly. Communication is really much better when using military time. The AM and PM abbreviations must be used, of course, with conventional time. Someone may forget to include AM or PM after they've written the time down. If this happens, the correct time is not communicated. Harm to the patient could occur if the time is not recorded accurately. So you'll find that the majority of facilities that you would be working in do utilize military time. There are certain guidelines that must be followed whenever you're charting. First is you must use a pen. It would never be acceptable to use a pencil because you could erase that, and you would never want to have the capability of erasing information that is on a legal record. The pen is always either black or blue. I see black utilized more often than blue. There are a few facilities that I am aware of that would still use a green for the PM shift and red colored on night shift, but with the use of military time, I'm not seeing that happen very often. If you are expected to chart in something other than black or blue pen, you will be made aware in your facility orientation. Another guideline is be sure that you check that you have the right patient, the right chart, and that you have the right room. Always date and time every entry that you make. Chart the entries in correct sequence. For example, chart the care that is given in the order that it occurred. If a bed bath was given before the person was ambulated, be sure that you chart that in the correct sequence. Use accurate spelling and punctuation in your charting. Remembering this is a legal document, you want to make sure that it is correctly spelled, all the words that you utilize. If you have a problem with spelling, then utilize the medical dictionary that's available in your facility, or ask somebody else the correct spelling of words until they're more comfortable for you. Or also, some of the people I'm aware of get in a little electronic handheld speller that they just keep in their pocket and then can look up the correct spelling of words if it's a problem. Keep charting legible and either print or write clearly. Leave no empty lines or spaces. Draw a line through any blank space. This will prevent others from recording in a space that includes your signature. You are not permitted to use any ditto marks. So if you're going to be writing the same thing 2 or 3 different times, you need to write the words out in longhand or electronically. You need to write the information out, but you may never use ditto marks. Always sign each entry utilizing your first initial, last name, and your title. Never erase or use any whiteout on an error. Draw one single line through the mistake, that means so that it can still be seen, and write the word error above it and include your initials. Only chart what you have done yourself. You would never chart for someone else or ask someone else to chart for you. Each facility has a particular form or type of charting to be completed by its caregivers. The goals, however, are the same. That is to provide a record of care and treatment given, and to record the patient's response to that care in the most accurate mannerism possible. This written communication among members of the healthcare team is vital to the safety and benefit of all of those who are in our care.